Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Steroids are among the most powerful drugs used in medicine today. They can save lives, but they can also cause serious harm. So why are they both superheroes and villains in pharmacology? Let's break it down. When most people hear steroids, they usually think of athletes illegally boosting muscle mass. Those are anabolic steroids. But in medicine, when we say steroids, we usually mean corticosteroids. These are drugs that mimic cortisol, a hormone your adrenal glands naturally produce. Cortisol is your body's built-in stress manager. It helps regulate metabolism, controls inflammation, supports blood pressure, balances fluids, affects mood and memory, and even follows a daily rhythm to keep your body in sync. Corticosteroid medicines, like prednisolone or dexamethasone, are basically cortisol on steroids, pun intended. So what makes them so powerful? The secret is in how steroids work when inflammation is out of control. Corticosteroids bind to glucocorticoid receptors in the cytoplasm. After ligand binding, glucocorticoid receptors dimerize. Then they go straight into the nucleus, where they bind to glucocorticoid response elements on DNA. As a result, they can silence genes that fuel inflammation, like cytokines, prostaglandins, and interleukins, while boosting genes that produce anti-inflammatory proteins. It's like hitting the master switch of the immune system. That's why steroids can be life-saving in asthma attacks, autoimmune diseases, severe allergies, and even COVID-19. But with great power comes great side effects. Because steroids act on so many genes and pathways, they affect almost every system in the body, not just inflammation. So, let's talk about the most common problems associated with steroids and how they actually happen. Long-term steroids mimic high cortisol levels, and that changes the way your body stores fat. Fat is redistributed, leading to the classic moon face, fat around the trunk, and thin arms and legs. At the same time, protein breakdown weakens skin and muscles. Steroids suppress bone-building cells called osteoblasts, speed up bone breakdown by osteoclasts, and reduce calcium absorption from the gut. Put that together, and bones become thinner and more prone to fractures. Because steroids suppress the pro-inflammatory signals that normally help the body fight infection, the immune system is weakened. That's why infections become more likely, and often more severe. Normally, your brain tells your adrenal glands to produce cortisol. But when you're taking steroids, the body senses there's already plenty of cortisol around, so the adrenal glands go quiet. Over time, they can forget how to make cortisol. Clinically, this means if you suddenly stop steroids, or face a major stress like surgery or infection, you may not have enough cortisol to survive. This can trigger an adrenal crisis, a life-threatening emergency manifested with severe low blood pressure, shock, electrolyte imbalances, and dangerously low blood sugar. Cortisol also helps regulate brain circuits involving dopamine, serotonin, glutamate, and GABA. Too much steroid exposure can alter neurotransmitter balance, leading to insomnia, mood swings, anxiety, or in rare cases, full-blown psychosis. So, why do doctors still prescribe them? Because in many conditions, nothing else works as fast or as effectively. The key is to use the lowest effective dose, for the shortest time possible. And when needed long-term, always under close monitoring. To sum it up, steroids are powerful because they control gene expression at the core of our cells. They're dangerous because their effects are broad and non-selective. Think of steroids like a powerful tool. In skilled hands, they can build and repair. But if misused, they can cause serious damage. So next time you hear steroids, remember, they're not just muscle boosters. They're one of the most important, yet most double-edged drugs in modern medicine. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.